Hello, my name is Kayla Vargas, and I will be talking about the potential dangers of unstocked Pxysis in the PACU. So, the PACU is a post anesthesia care unit. We see a wide variety of patients that are coming out of surgery. So, that's the common ground of these patients. They could be any acuity level, have undergone any type of surgery, can be any age, but their commonality is that they just got out of surgery. Um, the clinical issue that I ran into is that the PACU has 6 available Pxyses. And it sounds like that would be good because then you have a lot of medications available. But actually, each Pxysis is stocked differently with different kinds of medications available. And there is no way for the nurse to know which medications are in which Pxysis until they go to a Pxysis and try to pull the medication. So, why is this important? Well, the PACU is high acuity and a fast-paced environment. So not having the medications available in every Pxysis causes delay in medication administration and also an interruption in a nurse's workflow. Um, so according to a study done by Jeffrey in 2024, Pxysis influences medication errors by not having the medications available. So that's why it's important. And also workflow interruptions. You see, the nurse has to run to several different Pxysis to get a handful of medication. This leads to an increase in mental workload. And mental workload can just be how stressed the task is or how hard it is, how cognitively taxing something is. And so we know that's true for nursing. But mental workload is directly impacted by the difficulty of a task, the time a task takes, and how operable a machine is. This is proved according to a study done by Sean in 2023. So, what are some cues? Well, generally, as I said before, there's 6 Pxyses. Each Pxysis has different meds. The RN is frequently traveling to several Pxyses for one patient. There is a high patient turnover, but there's also some individual patient cues. I had one patient who was completely stable, but he had multiple medications ordered. So my preceptor had to go to multiple Pxyses to round up this patient's medication. And then I also had another patient who was at first he was stable, but then he went into something called a vasovagal syncope episode, which means that his vital signs were deteriorating. He had symptoms as if he was going to pass out. He was symptomatically bradycardic, and my preceptor had to go to 2 different Pxyses to retrieve atropine to try to treat him for his symptomatic bradycardia. So this was an emergent situation. So with this second patient, we can see why going to different Pxyses could be harmful because this situation was emergent. He was high acuity, and any kind of medication delay could be detrimental. But with the first patient, we see like maybe it's not as bad. Maybe it's not as emergent for the patient to get his medication right away because he's stable. But the problem with the patient, one example, the problem lies with the mental workload that this causes the nurse. So the nurse that has to constantly go to different Pxyses, this increases workload because it increases the difficulty. It increases the time it takes, and it decreases the usability of the Pxysis. So we know that running around to different Pxysis increases mental workload for the nurse. So my hypothesis would be that if Pxysis machines are not uniformly stocked, this will increase mental workload and delay medication, putting PACU patients at risk. So what's specifically at risk? patient safety and positive work environment for nurses. So patient safety is twofold. We see a delay of medication in emergent situation, just as we saw in my patient number 2. And it was dangerous for atropine to be delayed because he's actively declining. But also in my first patient example, it's not as easy to understand why that would put the patient at risk for safety. But when a nurse has a high mental workload, this causes poor task performance. And that really goes into the positive work environment for a nurse to be decreased. So that's what's at risk here. Nurses are trained to deal with workflow interruptions. It's not that nurses cannot have zero workflow interruptions. It's really just a part of the job. And nurses are trained to deal with this. And it happens every single shift with every single patient. You're trying to help the patient change his seats, but then when you go in there to do that thing, he needs something else. Or a family member is talking to you about something else. Or a doctor needs you for something else. So nurses are trained to deal with workflow interruptions. But the problem is that when the nurse continuously has these overwhelming workflow interruptions, these increase their mental workload. And this mental workload then creates something called negative affect. Negative affect are feelings of anger, frustration, and fear. So the nurse will start to feel fearful or angry or frustrated. This then leads to poor task performance. So then we ask, well, if the nurse is trained to deal with this, why does it matter that we fix this problem? Well, on a hospital standpoint, on a systemic standpoint, we have to do everything in our ability to decrease these workflow interruptions or try to decrease a nurse's mental workload so that they can care for a patient in the best of their ability. So if there's something systemically that can be helped, which could be policies or things of that sort, then we should implement them so that this negative affect, this mental workload could be decreased on nurses so that they could care for the patient better. So in generating solutions, solution number 1 would be most ideal. It would be for each Pxyis to have every kind of medication available, but space often doesn't allow that. So solution number 2 is more practical. So there are a handful of medications that each PACU patient will receive, it will be ordered for them. That's nausea meds, NSAIDs, opioids, etc. And since most patients will be receiving these medications, having these stocks in every Pxyis will lower workflow interruptions significantly. And also, hemodynamically, drugs like hemodynamic drugs like vasopressors should be also stocked in every Pxyis because they're used for emergent situations. So we don't want to delay those administrations. And what would the outcome I would expect because I wasn't able to implement this? Well, I would expect timely emergent medication to be administered faster than before. I would also expect a decrease in mental workload and an increase in nurse satisfaction. In conclusion, and when discussing this with my preceptor, he said that making sure that each Pxyis is properly stocked will ensure patient safety and reduce nurse frustration. And through my observation, of course, implementing procedures and policies to help improve workflow will greatly help patient outcome and nurse satisfaction. And here are my resources. Thank you.